Good afternoon, everyone. My name is Ellen Lee. I'm a geriatric psychiatrist and a researcher at UC San Diego and at the San Diego VA Hospital. Thank you for inviting me here to talk to you about sleep and how it relates to health, which is an important part of my clinical and research work. My work has been funded by grants from the National Institute of Mental Health, as well as the Brain and Behavior Research Foundation. I am also a co-investigator in the UCSD IBM Center for Artificial Intelligence for Healthy Aging. There's been a lot of attention in the media of how important sleep is for health. This New York Times article stated that sleeping more is the simplest way to drastically improve your life. And sleep deprivation, which affects 1/3 of all people, has negative effects on health and well-being. On the other hand, the CNN article points out that even too much sleep can be linked to poor health. So ultimately, sleep is quite heterogeneous among individuals, and sleep is related to health, but it's not clear for each person what is the optimal amount or quality of sleep, or what is the impact on health. So for today's talk, I'll go over what happens when you sleep and talk more about two common sleep disorders, insomnia and obstructive sleep apnea, and how they impact health. I'll talk about sleep during the COVID-19 pandemic, and then briefly review a few sleep treatments. So what happens when you sleep? Sleep is a biological process that is key to development and health. Sleep has been shown to have a number of important functions, such as in promoting growth, regulation of metabolism in organs like the heart and the lungs, solidifying memories, clearing toxins, and dreaming. And we know that sleep changes as we age. From infancy, when we spend 70% of our days sleeping and often wake to start our days around 5 a.m., we grow into becoming teenagers with phase-delayed sleep, going to sleep late, often after spending a lot of time on our screens, and then waking up late. When we become adults, our sleep phase shifts earlier again. We go to sleep earlier and we wake earlier. However, most adults do not sleep well. 35% of Americans are sleep deprived, which means sleeping less than 7 hours a night. About 50 to 70 million US adults have a sleep disorder, the most common being insomnia. 30% with short-term issues and 10% with chronic issues. And unfortunately, these issues worsen as we age. Older adults have higher rates of insomnia and other sleep disorders, as well as more frequent overnight awakenings and shorter overall sleep time. About half of older adults report having sleep problems. Next, I'll talk more about insomnia and obstructive sleep apnea and how they impact health. Insomnia is defined as dissatisfaction with sleep quantity or sleep quality with at least one of the following problems: difficulty falling asleep, difficulty staying asleep, waking too early and not being able to fall asleep again. And these are causing clinically significant impairment or distress in at least one of these areas: fatigue or low energy, daytime sleepiness, mood problems, behavioral difficulties, trouble with cognitive functioning, such as impaired concentration, attention or memory, trouble with occupational or academic functioning, difficulties with interpersonal or social relationships, and having a negative impact on your ability to caregive for your family. And diagnosing insomnia starts with a clinical evaluation to rule out other medical causes that can interfere with sleep. It can be helpful to track sleep nightly using a sleep diary, and this way we can see the patterns of bedtimes, awakenings, and sleep quality, as well as the use of caffeine, alcohol, and medications. We may also use questionnaires to inquire about symptoms, lab tests to rule out other medical issues, and sleep studies, which I'll describe in a little bit more later. Obstructive sleep apnea is a temporary collapse of the airway while sleeping, and this leads to a cessation of breathing and a dip in oxygen saturation. Obstructive sleep apnea, or OSA, occurs because the muscles in the throat are relaxed while sleeping, and they may hang into the airway due to the positioning. Signs of obstructive sleep apnea include snoring, cessation of breathing while asleep, choking and gasping while asleep, excessive sleepiness during the daytime, and morning headaches. And having a large neck circumference can be an independent risk factor for obstructive sleep apnea. Diagnosing obstructive sleep apnea starts with a clinical evaluation to rule out other medical problems that can interfere with sleep. We may also use questionnaires to inquire about symptoms and lab tests to rule out other medical issues. Ultimately, an overnight sleep study is needed to assess for sleep apnea. In-lab sleep tests, such as the one shown here, include EEG monitors for brain activity, a nasal cannula to measure airflow, a pulse oximeter on the finger to assess oxygen saturation, and a chest strap to assess respiratory effort. The home sleep test can provide much of the same information about the presence and severity of sleep apnea, although it only involves a nasal cannula, pulse oximeter, and chest strap. However, the home sleep test does allow patients to test themselves within their own homes and their own beds. As I mentioned earlier, one of the major functions of sleep is to clear toxins from the brain. These include proteins like amyloid and tau, which are key in the pathogenesis of Alzheimer's dementia. Insomnia, obstructive sleep apnea, short sleep duration, and poor sleep quality have all been identified as independent risk factors for cognitive impairment, as well as the development of Alzheimer's dementia and vascular dementia. One study showed that among people who had increased genetic risk for dementia, having obstructive sleep apnea was associated with a 66% higher risk of developing dementia. Poor sleep has also been linked to mood problems such as depression and anxiety, and this link appears to be bidirectional, where people who are depressed and anxious are more likely to develop sleep problems, and those who have sleep problems are more likely to develop depression and anxiety. Studies have shown that people who sleep 5 hours or less at night or have more overnight awakenings are more likely to experience falls compared to those who sleep longer or have less overnight awakenings. One study showed that people who had worse sleep quality had a 1.5 greater odds of experiencing falls over the following year. In addition, the impact of sleep on organ function has shown that poor sleep, insomnia, and sleep apnea are linked to metabolic problems like obesity, cardiovascular issues like hypertension, and even a compromised immune system. And these problems have been magnified by the recent COVID-19 pandemic. 41 to 70% of older adults reported sleep problems during the COVID-19 pandemic, and a number of them stated that this was worse sleep than pre-pandemic times. These sleep issues were associated with anxiety, depression, loneliness, not working, home confinement, as well as physical distancing procedures. In our collaboration with IBM, we have been exploring loneliness and psychosocial functioning among older adults. With the COVID-19 pandemic, our study participants have reported decreased social interactions, and a number of them have reported feeling lonely. Other research has demonstrated that loneliness is associated with sleep disruptions, poor sleep quality, as well as insomnia. And using fitness trackers, we examined 362 nights of data from 39 older adults. This graph shows the density curve plots that map out the total sleep time in minutes for each individual. And that's basically the amount of time they slept each night. Each individual is represented by a curve. The lonely individuals are shown in red and the not lonely in blue. And the flatter curves are individuals with more variability in total sleep time. And we found that while mean sleep duration was similar between lonely and not lonely individuals, intra-individual variability of sleep was higher for lonely adults. Basically, lonely older adults have more night-to-night variability in the amount that they sleep compared to non-lonely adults. We also examined physical activity patterns in this group, and similarly, we found, shown in the graph on the right, that people who were more lonely had less variability in the number of daily steps they had. And that was also related to how much activity they had every day. So we're planning to examine further how these physical activity and sleep behaviors may reflect psychosocial functioning among older adults. I'm also working on a study of sleep apnea in a healthy aging cohort using the home sleep test, which was shown earlier. In this subsample of 25 older adults ranging from age 67 to 91, we found that, that most were women, Caucasian, and married. They were monitored for about 7.5 hours on average overnight, and we excluded anybody who had been diagnosed with sleep apnea. And in this subsample, the mean number of apneic or hypopneic events per hour, which is a way to assess severity of sleep apnea, was surprisingly high. It was 12.5 events per hour, which falls into the mild sleep apnea category. And we found that 32% of the sample had mild sleep apnea, while 25% had moderate to severe sleep apnea. We also found consistent and significant relationships between the number of these apneic and hypopneic events with a number of cognitive functioning measures. So we found that better premorbid intellectual functioning, better executive functioning, better working memory, and better verbal learning were associated with fewer apneic and hypopneic events. And we'll be examining how the treatment of sleep apnea could improve cognitive aging among older adults as well as adults with schizophrenia. And good quality sleep is important for optimal immune functioning. Even a single night of poor sleep can affect inflammatory biomarker levels, lymphocyte counts, and the antibody response to a vaccine the following day. Chronic poor sleep upregulates the innate immune system activity as well as affects leukocyte trafficking. Our work in schizophrenia, bipolar, and healthy adults have shown that night-to-night variability of sleep patterns, or how much one's sleep changes from one night to the next, is strongly associated with inflammation. And we're seeing that individuals who have these more labile sleep patterns have increased levels of inflammation. We're studying patterns of sleep in older adults as well as with serious mental illnesses to see how these night-to-night changes affect biological processes, including inflammation and oxidative stress. Last, I'll be talking about some of the common treatments for sleep apnea and insomnia, as well as some of the general recommendations to improve your own sleep. So broadly, insomnia has two major treatments, medications to help induce and sustain sleep, as well as a special form of psychotherapy called cognitive behavioral therapy for insomnia, or CBTI. CBTI is a treatment that works on changing the behaviors and the negative cognitions you may have around sleep to help you increase the amount and the quality of your sleep. So medications can be helpful for acute problems, and there's a number of over-the-counter and prescription options. However, in general, medications are associated with side effects and can increase your risk, have an increased risk for becoming dependent upon them. While cognitive behavioral therapy for insomnia is generally very safe and effective and can have lasting effects on chronic insomnia, it does require a fair bit of motivation, as well as time and the ability to find a trained therapist. It can take upwards of 6 weeks in most cases. On the other hand, the most common treatment for obstructive sleep apnea is continuous positive air pressure, or CPAP. And what happens is this bedside machine pumps out air through a hose that then feeds into a mask, which is worn over the nose and mouth or just over the nose, to then force air into the airway and prevent the collapse of the airway. Another possible second-line treatment is the oral appliance therapy. So this device, like the one shown here, can be worn over the teeth to then pull forward the jaw and open the airway while asleep. Surgery is used in a select number of cases where the anatomy of the palate and throat muscles are unusual and contributing primarily to the sleep apnea. We're also seeing the rising importance of lifestyle changes, such as exercising, eating a healthy diet, and ultimately losing weight. Losing weight can improve obstructive sleep apnea in nearly all patients. So what else can we do for our sleep? So there are a number of different recommendations called sleep hygiene that can improve sleep for the vast majority of patients, especially those without a sleep disorder. They include things like avoiding caffeine, alcohol, nicotine, and exercise around bedtime, as all of these things can be stimulating. It also involves establishing a regular routine, like exercising regularly and having regular meals. Having regular bedtimes, even on weekends, can be important to maintaining good sleep habits. If you change your bedtime and awakening by more than 1 hour throughout the week, you can often see increased risk for metabolic problems. It's also important to make sure you have enough sleep and finding time to schedule at least 7 to 9 hours of sleep a night. Having calming bedtime routines, like avoiding stimulating television or stressful tasks before bed, can also help people unwind. Keeping the place where you sleep a dark, quiet, and cool environment without any blaring or bright clocks shining in your face. And restricting the use of your bed for only sleep and sex. So no eating, studying, TV watching. You want your bed to be associated with restful, quiet sleep. Now, specifically during the COVID-19 pandemic, there are a number of different sleep hygiene mechanisms or sleep hygiene tips that can also be helpful. It can be helpful to go outdoors every day and get natural light. Practice mindfulness and self-compassion as well as gratitude to help manage your anxiety and stress. Maintain a daily routine, even though nowadays people are saying one day seems much like the next. Cultivating meaningful daily social interactions while being safe. And it's important here to find ways to maintain social connections and stave off loneliness. Celebrating milestones and planning for the future. And of course, seeking medical help whenever appropriate. The thing about sleep problems is that they are very common, but they are also very treatable. So it's really important to make sure you get the right workup and treatments necessary for any sleep issues you're having. And ultimately, our goal is to really understand how these different facets of sleep are related to sleep, to lifestyle habits like physical activity and diet, mental health and cognition, and physical health on the level of an individual. The mechanisms of why and how we sleep are still a mystery. However, we do know that there are ways that we can improve sleep. And understanding the relationships between sleep and health can help us develop new ways to improve sleep. Thank you so much for your time today. I'd like to acknowledge all of my wonderful collaborators at the Stein Institute for Research on Aging and the Center for Healthy Aging at UC San Diego. I hope that you all stay safe and sleep well.